Dr. Baliga here. This podcast discusses whether we do really need to wear a homemade face mask once the lockdown is lifted. And the answer is yes. It is particularly important to wear masks in locations with conditions that can accumulate high concentrations of viruses, such as doctors' offices, hospitals, and other healthcare settings, airplanes, restaurants, and other crowded places with reduced ventilation. What about outdoor environments? Outdoors, numerous factors will determine the concentration and distance traveled, and whether respiratory viruses remain infectious in aerosols. Breeze and wind often occur and can transport infectious droplets and aerosols long distances. Viruses can attach to other particles, such as pollution and dust, which can modify the aerodynamic characteristics and increase dispersion. Particularly, people living in areas with higher concentrations of air pollution have been shown to have a higher severity of COVID-19. Because respiratory viruses can remain airborne for prolonged periods before being inhaled by a potential host, studies are required to characterize the factors leading to loss of infectivity over time in a variety of outdoor environments over a range of conditions. There is no question viral concentrations are more rapidly diluted outdoors. Additionally, the SARS-CoV-2 virus can be inactivated by the ultraviolet radiation in sunlight and is likely sensitive to ambient temperature and relative humidity. N95 masks and surgical masks have viral filters, unlike homemade face masks. So one could argue, should we really wear face masks? Face masks may be 60% effective, but if 60% of the individuals wear face masks, homemade face masks, the transmissibility of COVID-19, that is R0, will be reduced to less than 1 and will therefore decrease transmission of the infection. Respiratory infections occur through the transmission of virus-containing droplets, which is 5 to 10 micrometers in size, and aerosols, which is less than or equal to 5 micrometers, exhaled from individuals during breathing, coughing, speaking, and sneezing. A large proportion of the spread of COVID-19 appears to be occurring through airborne transmission of aerosols produced by asymptomatic individuals during speaking and breathing. Aerosols can accumulate, remain infectious in indoor air for hours, and be easily inhaled deep into the lungs. Therefore, when the lockdown is lifted, measures designed to reduce aerosol transmission, such as wearing masks, must be implemented, including universal masking and regular widespread testing to identify and isolate infected asymptomatic individuals. The typical size of respiratory droplets range from 0.1 to 1000 micrometers. A competition between droplet size, inertia, gravity, and evaporation determines how far emitted droplets and aerosols will travel in air. Respiratory droplets can undergo gravitational pull and settle faster than they evaporate, contaminating surfaces and leading to contact transmission. Smaller aerosols, that is equal to or less than 5 micrometers, will evaporate faster than they can settle, are buoyant, and thus can be affected by air currents which can transport them over longer distances. Therefore, the two major transmission pathways for COVID-19 is contact, either direct or indirect between people and with contaminated surfaces, and by airborne inhalation. Studies have shown that asymptomatic individuals may be responsible for up to 79% of viral infections. Estimates using an average sputum viral load of SARS-CoV-2 virus indicate that 1 minute of loud speaking could generate viral containing aerosols. Assuming viral titers for infected super emitters with 100-fold higher viral load than average yields an increase to more than 100,000 virions in emitted droplets per minute of speaking. Calculations predict that in still air, a 100 micrometer droplet will settle to the ground from 8 feet in 4.6 seconds, whereas a 1 micrometer aerosol particle will take 12.4 hours. Measurements show that intense coughs and sneezes can propel large droplets more than 20 feet and can also create thousands of aerosols that can travel even further. The overall probability of becoming infected indoors will depend on the total amount of SARS-CoV-2 virus inhaled. The viral load is therefore important. Overall, the amount of ventilation, the number of people, how long one visits an indoor facility, and activities that affect airflow will modulate viral transmission pathways and exposure. Therefore, it is important to wear properly fitted masks indoors, even when 6 feet apart. Epidemiological data from countries have shown that wearing masks can reduce the spread of COVID-19. Universal masking implemented in Taiwan, Hong Kong, Singapore, and South Korea was effective. Taiwan has a population of 24 million. The first COVID-19 case was reported 21st January 2020. They did not implement a lockdown during the pandemic, yet maintained a low incidence of 441 cases and 7 deaths as of 21st May 2020. By contrast, the state of New York, population 20 million, first COVID case 1st March 2020, had a higher number of cases, 353,000, and 24,000 deaths. Another natural experiment is comparing the Czech Republic and Austria, both of which introduced social distancing on the same day. The Czech Republic also introduced compulsory face coverings. New COVID-19 infections fell more quickly in the Czech Republic and only began to fall in Austria after masks were made mandatory 2 weeks later. Although an alternative interpretation of this natural experiment is that Austrian data was confounded by changes in testing policy. But what is noteworthy is the observation that every single country where masks or cloth coverings have been introduced as national policy, often but not always alongside other measures, rates of transmission fell in subsequent days. This is particularly important indoors, particularly in crowded public places where social distancing is impossible during the pandemic. The face mask could make a big difference in super spreader events, particularly in places where people are up in each other's faces, laughing, shouting, cheering, sobbing, singing, greeting, and praying, like in choir practices. Unlike in the operating room, in a community-wide intervention, we do not need to prevent every transmission of every droplet of every viral particle. Hygiene, hand washing, social distancing, and wearing a homemade face mask can achieve substantial reductions in the transmission rate of the virus. Mathematical modeling suggests that a face covering that is 60% effective at blocking viral transmission and is worn by 60% of the population will reduce the R0 to below 0 and prevent transmission of the pandemic. Material scientists have shown while different fabrics have different efficiencies, blocking particle transmission, cotton weaves with high thread count or a double layer of two different fabrics, example cotton flannel, typically produce a high filtration efficiency. Unlike N95 masks, cloth and surgical masks do not fit tightly. One can breathe air coming in around the sides. They are designed to safeguard others and not the wearer. The basic logic is I protect you and you protect me. Benefit of the wearer may be limited, but it's likely not insignificant. While surgical masks reduce inhalation of respiratory droplet-sized particles by about 3/4, the two-layer cotton masks filter about half as much on average, though a good fit can improve that considerably. In addition, masks prevent wearers from touching their noses and mouths. In Hong Kong, during the SARS epidemic, people who were wearing masks in public frequently were half as likely to become infected by the SARS coronavirus as those who did not. The N95 masks or respirators should be worn in the COVID unit. These masks are designed to fit tightly around the nose and mouth so that the air you breathe becomes entirely through the mask and not around it. They use a filter material with a higher electrostatic charge that blocks at least 95% of airborne particles as small as 0.3 microns. It is a mask which I protect you and I protect me. Currently, there is a limited supply of N95 masks. The N95 mask with a valve should not be worn in a pandemic. The valve makes exhalation easier by getting rid of outward filtration. It is I protect me and I expose you. These masks are designed for people working in industrial settings where the protection is against dust or asbestos and not for viruses. The only way we can contain this pandemic is by social distancing, hygiene, wearing masks, including homemade face masks, and screening for asymptomatic individuals.